Good morning, students. So now coming to the last part of pharmacology, that is antimicrobials. So the first part that we are going to take are the general considerations of antimicrobials. So we'll take the general considerations, then we will take the non-specific antimicrobials, and then the specific antimicrobials, which will include anti-tubercular, antiviral, anti-leprosy, antifungal, anti-protozoal, anti-helminthic, and anti-HIV also. So I hope to complete this series in this antimicrobial in 3 lectures, and then we'll be done with the rapid revision series. So coming to the first part of general considerations, there is something called as drug resistance. So drug resistance के different mechanisms होते हैं. They can be natural or acquired, right? या तो naturally resistant होते हैं या फिर acquired resistance होता है. Then this acquired resistance can be because of a single step mutation, or it can be because of multiple step mutation, right? Now drug resistance can be transferred also by the gene. Now this gene transfer is also called as infectious resistance. And what are the mechanisms by which it can transfer? It can transfer by conjugation, then it can transfer by transduction, and it can transfer by transformation. Okay, now what is conjugation transfer? When there's a physical contact, so both the cells, they come into contact physically, and this is developed, this causes this mechanism is responsible for development of resistance in chloramphenicol and streptomycin. Okay, then what is transduction mechanism? Transduction mechanism is transfer through a bacteriophage. So a bacteriophage takes the gene from one cell to another, and this type of transfer is seen in penicillins, then erythromycin, and also chloramphenicol. Okay, the next is transformation. It is the transfer of resistance gene through the environment. There is no physical contact and there is no bacteriophage, through the environment, and it is not very significant clinically. It is mainly seen in penicillin G. Right, now the resistance mechanism क्या होता है resistance develop करने के? What are the, like, what exactly is happening? So mechanisms can be decreased affinity for the target, right? Then development of alternate metabolic pathway, right? Or then production of enzymes that inactivate the drug. So these are the various mechanisms by which the resistance can happen. Another, yes, there are more. There can be decreased drug permeability, like the channels through which they are going, they become impermeable, like aminoglycosides and tetracyclines के case में होता है. And then development of efflux pumps by the bacteria, so they pump the active drug again outside. So these are various mechanisms by which the resistance can happen. Now if I talk individually, so decreased affinity for target, so this happens in the antibiotics, that is MRSA and vancomycin. See, questions are asked on individual what is the mechanism of resistance in this drug, so you need to have this knowledge. Alternative metabolic pathway is generated in which drug? That is sulfonamides. Okay, then inactivating enzymes. Inactivating enzymes, यहाँ पे कौन सा ड्रग आती है? This is aminoglycosides, beta lactams, and chloramphenicol, right? Then reduced permeability. Reduced permeability is seen in aminoglycosides and tetracyclines. Okay, and then efflux pumps. So efflux pumps are seen in tetracyclines, erythromycin, and fluoroquinolones, right? So these are the various drugs and their mechanisms of resistance. The next topic that we do is, the second topic is superinfections. Sorry, superinfections. So what are superinfections? That means a new infection in due to antimicrobial agents. Now इसमें जो what are the drugs? Normally normal microbial flora that contribute to the host defense. Now in broad spectrum antibiotics, they broad spectrum antibiotics जो होती हैं, what are they? Broad spectrum में we have tetracyclines, chloramphenicol, then clindamycin, then aminoglycosides, and ampicillin, right? So these drugs, broad spectrum antibiotics, they normally result in development of they kill the normal flora also, and they result in development of new infection. Superinfections are very common. First of all, they don't happen in everyone. They are common in immunocompromised patients, right? The common places are oropharynx, intestine, respiratory route, genitourinary route. These are common areas for development of new infections. And the common organisms that cause superinfection, the सबसे पहला is Candida, which causes candidiasis. Then we have Clostridium difficile, which causes diarrhea, Staphylococcus, and Proteus, and Pseudomonas. Right, so these are the bacteria which cause the superinfections. Clostridium difficile superinfections को बोलते हैं pseudomembranous enterocolitis. I'll write it separately because this is asked many times. Clostridium difficile causes pseudomembranous enterocolitis. Okay, this is most commonly because of this particular happens because of third generation cephalosporins. Now, what are the drugs which are used in this pseudomembranous enterocolitis? The treatment is given by oral vancomycin. Then another drug that can be given is fidaxomicin. Okay. Another alternative drug is metronidazole. Right. Now another and a monoclonal antibody has also come up. Its name is bezlotoxumab. This has been approved to reduce the recurrence of Clostridium difficile. Then there is also usually warfarin के साथ देखा होगा आपने कि वो reduced microbial flora and reduced vitamin K producing bacteria होते हैं. Then now coming to another important definition is called as concentration dependent killing, time dependent killing and post antibiotic effect. इन तीनों चीजों को समझते हैं. Concentration dependent killing, when basically the killing effect is of an antibiotic is high, killing effect is high when the ratio of peak concentration to MIC is more. This type of killing behavior is usually seen by the aminoglycosides and fluoroquinolones, right? So these drugs, they are very good as large single dose. So when their concentration is much above the MIC, they are very effective. Now, what is time dependent killing? Time dependent killing is basically the killing effect is more. Killing effect is more when the length of time the concentration remains above MIC is more, right? So these things, this particular scenario is seen with the beta lactams and also seen with vancomycin. So in case में we have to give multiple daily doses are preferred over single dose because they are more effective when they are their concentration remains above MIC for a longer duration. And the third part is PAE. Now PAE is also called as post antibiotic effect, means after the antibiotic is not there in system, still the growth of bacteria is inhibited, right? So even after the antibiotic is not there in the system, the growth of the bacteria is inhibited. So that is post antibiotic effect. Now usually the drugs which are showing antibiotic effect, there are many. The beta lactams are there, then drugs affecting protein synthesis, these antibiotics are there. So this was about the concentration dependent killing, time dependent killing and post antibiotic effect. The next concept that we have to do is combined use of antibiotics. Now combined use of antibiotics may, see, if both static plus static is given, it will give an additive effect, right? Both cidal drugs are given together, it will give additive effect if the organism is sensitive to both. For example, we combine isoniazid plus rifampicin in tuberculosis. If you give static plus cidal, again it will be additive, but if the organism is sensitive to cidal drug, right? For example, we give streptomycin plus tetracycline combination for brucellosis, okay? But if you give static plus cidal, then this is antagonistic if the organism, यहाँ पे है low sensitivity, if the organism has got a high sensitivity to cidal drug. For example, if you give penicillin plus tetracycline for pneumococci, then in that case the static drug will inhibit the action of cidal drug and this combination will become slow or antagonistic, right? Now what are the, let's come to the factors affecting the action or choice of an antimicrobial. तो सबसे पहले आता है एज. एज में क्या फैक्टर होता है? जैसे क्लोरामफेनिकॉल के साथ it is given in newborn and it results in gray baby syndrome, okay? Then sulfonamides, if given in newborn, will cause kernicterus. Then half-life of aminoglycosides is increased in elderlies. Tetracyclines, they are contraindicated in children below 6 years because it affects the teeth and the bones formation, okay? Then next factor that is important is pregnancy. Now a lot of antibiotics have got several teratogenic effects. So in pregnancy, like if you give tetracycline, then it will affect the dentition of the newborn. So tetracyclines are not given. Then the only antibiotic which are safe, which can be said as safe antibiotics in pregnancy, are penicillin, cephalosporins and erythromycin or macrolides, okay? So these are the antibiotics which are safe. Then another thing is, if the patient has impaired host defense mechanisms. So impaired host defense mechanisms में the bactericidal drugs are must in immunocompromised patients, right? Next, in liver disease, in hepatic disease, there are some antibiotics which are used, which are not used. So let us see in renal function. Renal function, में which medicines to be used and which not used. So totally contraindicated in renal function if the patient is having renal disease. सबसे पहले आती हैं cephalothin, cephaloridin, nitrofurantoin, nalidixic acid, and tetracyclines, except doxycycline. Okay, then dose reduction required is aminoglycosides, amphotericin B, vancomycin, and ethambutol. Okay, so these drugs, they need a dose reduction. Then we have drugs which are affected by liver diseases. So liver function में which antibiotics are contraindicated. So contraindicated medicines are erythromycin, tetracyclines, pyrazinamide, and pafloxacin. Okay, drugs in which dose reduction is required. So dose reduction is required in chloramphenicol, isoniazid, rifampicin, and clindamycin. Okay, these are the drugs in which dose reduction is required. Then some drugs are secreted in bile. So what are the drugs which are secreted in bile? These drugs, they are excreted in the feces, so they do not produce need a dose reduction in the renal failure. So the drugs which are secreted in bile is ceftriaxone, cefoperazone, tigecycline, rifampicin, and erythromycin, right? So these are the drugs which are secreted in bile. Other drugs are nafcillin, ampicillin, lincosamide, and doxycycline, right? Now after this, let's come to the classification. Now classification of antibiotics is done on multiple factors. So multiple ways of classification are: first classification is based on the type of action. So they can be either bacteriostatic or bactericidal. So in bacteriostatic drugs, I'll say the cidal drugs first. So cidal drugs में aminoglycosides, streptogramins, quinolones, metronidazole, these comes, penicillins, cephalosporins. Okay. Static drugs में we have tetracycline, chloramphenicol, macrolides, lincosamides, linezolid, nitrofurantoin, etc. ठीक है? Another classification is based basically on their metabolism, like what is the mechanism of action, based on mechanism of action. So in this we have the drugs which are cell wall synthesis inhibitors. Now cell wall synthesis inhibitors में we have penicillin, cephalosporins, vancomycin, bacitracin, phosphomycin, cycloserine. Okay, then drugs which are basically they affect the metabolism of the bacteria. So in this we have sulfonamides, PAS, ethambutol, dapsone, trimethoprim. So they basically affect the metabolism of the antibiotic, of the bacteria. Then another category of drugs are polypeptide inhibitors. So in this we have amphotericin B, colistin, and polymyxin B. Another thing that we have to discuss is the genetic factors which also can affect the choice of drug. For example, the patients who are G6PD deficient patients, in we don't contraindicated our malarial drugs like primaquine and chloroquine, quinine. These drugs are contraindicated because they develop what? Hemolysis, right? So these drugs are inhibited. Then another concept that you need to understand is the MBC. What is MBC? Minimum bactericidal concentration. This is the concentration which kills 99.9% of bacteria. Okay. While what is MIC? MIC is the concentration, is called as the minimum inhibitory concentration. This is the concentration which prevents the visible growth of bacteria in culture plates, right? So this is MIC. Now a difference between MBC, when MBC and MIC, if there is a small difference, then the drug is bactericidal. And if the difference between MBC and MIC is large, then it indicates bacteriostatic action. Okay. In immunocompromised patients always use bactericidal drugs. Okay. So now after this, we'll start with the first category of drug, that is drugs affecting the cell wall synthesis. Okay. So let's complete the drugs, non-specific antimicrobials one by one.